Hi, I'm Dr. Molly with Your Goals Physical Therapy. I wanted to share a story about a young woman or young mom that has a 5-month-old baby who was holding that baby in one of those baby carriers, which are amazing inventions. But in this case, it ended up causing a whole lot of back pain. To the extent that for this mom, on her left side, just below her shoulder blade, so like right in this area, it basically started there and then went all the way up into her neck and all the way down to her back. But to her, it felt like it was just sort of radiating from that one point and then up. But it was making breathing difficult. It was making moving difficult, let alone having to carry your baby, having to take care of your other kids, having to do all this housework. And so this poor mom was just very, very distraught, to say the least. She was feeling the pressures of not being able to take care of her newborn. She was feeling the pressure that her other kids needed her attention also, and she just wasn't able to move around like she wanted to. Not to mention, laundry doesn't wait for anybody, right? So all these things were just piling up on her, and it was just a lot for her. And so after listening to her and letting her kind of go over some of these things and certainly tell me about her pain and where it was coming from and what it was doing and all the things that was stopping her from doing, I was able to encourage her that I might not be able to fix all of the things that she just told me about, but I can certainly get rid of that back pain. And we can just eliminate that off off the list of things that aren't going well for you today. And I knew that she didn't really believe me, because why would anybody believe that if you're in that much pain? Like, how can somebody just get rid of that certainly in one day or make it so much better? And so I was like, and then once we get rid of this pain for you, I'm gonna show you how to alter how you're holding your baby, so maybe it's not putting so much pressure. And we're gonna give you a little bit of homework so that you can keep what we get done today and keep it going. And then we'll decide what we need to do at the end of the session in terms of continuing therapy or what we need to do for that. And so she was like, okay, well, let's see if you can stop this from hurting. And so she lays down. I spend a good amount of time trying to relax all of her muscles and going over some other things, some gentle hands-on techniques, and having her move through some active range of motion to help strengthen things and stretch some things out that needed to be stretched. And she got off the table and she was almost crying again. And I was like, are you in pain? Like, what's going on? Like, are you okay? And she's like, no, I just didn't really believe that anything that was that severe could just go away that quickly. And so she was very happy. She's still moving hesitantly because, you don't want to mess it up, right? Don't make anything move too much, right? You still believe that pain's there. So I was able to explain like what actually happened and what caused it, and then why it was able to get it to go away so easily. Because obviously that's not something that can be done all the time. I really wish I could take away people's pain that fast all the time. But in this case, I was pretty confident that was going to be 100% resolvable and very quickly, especially considering the pain had just started the day before. It's so much easier to get rid of pain. So even if it's really, really severe, stuff like that, the day after, than it is to get it if it's been festering for several months or years. But anyway, I digress. So then the important part came, where we talked about her ergonomics and how she was holding her baby and what posture she was holding, how tight things were and where things were set up with the carrier. So we were able to adjust a few of those things, so hopefully this doesn't become a reoccurring event. And as she is a new mom, I gave her some simple things. We talked about how much time she had to devote to exercises, and we found like the most important things and things that she felt that she could actually do on her own, and she felt confident that she could do them well and correctly and that she would be able to keep up with them. And so at this point, because this was just a couple days ago, we're waiting for a follow-up, but I just wanted to express sometimes it's easy just to let things fester for long periods of time, but really it can make a world of difference, especially if you feel like everything's colliding in on you, just to go talk with somebody and see if they can help you, because we all need help sometimes, and especially with moms, you can't take everything on all at once and expect that I mean, we're not super women, right? I mean, like we don't actually have the S on our chest, right? We are amazing parents and we are amazing moms, but sometimes we need help too. So I hope that information helps you, and I hope you're having a great day. Bye.